In the interest of time, I just want to make a couple of comments regarding what we've heard thus far, and then I'd like to read a couple paragraphs from our prepared statement. Oh, and by the way, it's Stephanie Mclean-Beathley. This morning we heard from Dr. Sullivan. Well, first of all, you see people wearing green. This month is Mental Health Awareness Month. Lime green is the color, so you'll see variations of green today in support of Mental Health Awareness Month. One of the things that Dr. Sullivan said this morning was that outpatient alternatives were being made available in lieu of hospitalization. You need both. You need both outpatient services to keep children well once they receive the necessary care in an inpatient setting. There is not enough outpatient services, but that doesn't mean you get rid of inpatient services. Also, the Western New York Children's Psychiatric Center just implemented a mobile integration team. I know that Assemblywoman Crystal Peoples-Stokes asked about that this morning, and there is something in the Community Services Office at the Western New York Children's Psychiatric Center. It is just getting underway. It is not more than maybe 3 months old, so there's no hard data yet to talk about how successful it's been with the individuals who've been assigned to that program. So it'll be interesting in the next 6 months or so to see what the outcomes have been for those children receiving services and whether or not they needed further inpatient treatment because outpatient wasn't successful. The other thing is about transportation. The Children's Psychiatric Center serves 19 counties. It's usually the halfway point between most of the counties. Buffalo is not the halfway point. The other thing is that most of the children who receive services at the Western New York Children's Psychiatric Center are not Buffalo residents. They are residents of these 19 counties. The other thing is that most of our families are afraid to come into the city of Buffalo for varying reasons. It is not the most optimal place to put our families and their children for that reason. And the reasons, be they good or bad, there's still reasons and they impact people's ability to willingly accept treatment and services if they don't feel comfortable. The other thing about transportation is gas cards are providing. We've heard about gas cards. The state does not account for those in their cost of services. The gas cards are provided through private donations. They are also accounted for through staff fundraising. The staff is fundraising to get these cards for families so that they can get back and forth to see their families. And the other thing is that there are a fleet of vehicles available at the Children's Psychiatric Center for families who take public transportation. We are able to drive to the Southgate Plaza, pick them up, bring them back to the facility so that they can meet their necessary counseling sessions or visit with their children. Also, Dr. Sullivan talked about activities, being able to go out and do activities. Children do activities in West Seneca right now, and actually it's a good starting point. It's not as congested and crowded and busy, and it allows for many short-term trip opportunities to the Southgate, the Fireman's Park, which is directly in front of CPC. The park has swing sets, there's opportunities for picnics, there's opportunities for baseball and soccer. Those do not exist where the proposed location is going to be placed. It also she talked about Forest Avenue being a state-of-the-art facility. State-of-the-art facility doesn't guarantee good treatment. It's just a facility. The good treatment comes from the professionals who are treating the children, and the children have the ability to heal properly. The clinical staff works well with the children, but also when staff is happy in their environment, and you've heard a lot about the environment. When staff is happy in the environment, they are able to give good treatment because they like where they're at. And we contend that those things work hand in hand. Also, Ms. Rock represented the president of my union, Susan Kent, today, and she talked about jobs. While jobs are important to the members, what's more important to our members is our children getting the type of treatment that they need and deserve at the Western New York Children's Psychiatric Center, and the fact that it is in West Seneca. I am the head of the Public Employees Federation Local 167, which represents the doctors, nurses, social workers, and professional technical staff that work with children at the Western New York Children's Psychiatric Center. Today, I also speak to you as a social worker, a former employee, a friend, and an impassioned advocate for the wonderful facility. The Western New York CPC serves 19 counties in the western end of the state. It currently has a 46-bed capacity. As of yesterday, the census was 1 over that 46, so there were actually 47 children residing in the facility on yesterday. It also has a substantial wait list for services, which is increasingly compounded by court-order admissions. These type of admissions take precedent, move to the top of the list, so to speak, thus further delaying admission for other acute care children and youth waiting and housed in local hospitals. Clearly, there is a need for more acute beds, not less. It is important to know that Western New York CPC is highly cost-effective. It is not a long-term facility. The average length of stay is only around 90 days. Successful treatment at CPC often further prevents long-term adult psychiatric admissions and more costly effective services down the road. As a society, we need to make a long-term commitment to our children and youth. We also need to take into consideration that the governor has said that children in juvenile justice systems do not belong with hardened criminals. They need their own services and facilities. Let me ask you, our most vulnerable children with severe mental illness also in need and deserve their own facility. OMH's ridiculous point that a few other facilities across the state house children and adults is no reason to dismantle what is arguably the best, certainly the highest rated children's center in the state of New York. OMH has not produced any evidence that supports their proposal that closure of CPC and its relocation is good for the children. They have not in good faith involved the community as stakeholders. They have not displayed transparency. They have tried to present this terrible plan as final and leaving the community with no option but to accept it. What OMH is trying to do is rob the community of a highly successful, vital state service by penny pinching, which is clearly a pound-foolish scheme and a lie. Our community will not accept nothing less than the best because that is what we've come to expect.
Thank you very much, Stephanie. You know, you said the average length of stay was 90 days. You know, it doesn't have to be today, but I'm sure it's available. You know, what I'd like to know is the average length of stay, the readmission rate, which is very, very important. And, you know, a lot of times within a year, within 2 years, is it, you know, next week, but the readmission rate, you know, and I've also heard, Stephanie, you're a Center for Excellence. You've been certified as a Center for Excellence. Am I correct about that? And those are very, very important. And, you know, if you can look, I'm sure you can get from year to year, because as the readmission rate goes down, number one, it means that you're providing quality health care, mental health care, which is very, very important. Secondly, if we look in terms of the money spent, and thirdly, I think we were witnesses to children that were inpatients at this facility, and what their story is. And, you know, I know that sometimes my children didn't want to be seen with me in ShopRite. So if they saw friends or whatever, you know, kids during teenage years. So, I mean, they're telling a very compelling story. And I really want to congratulate you and all the employees, because the testimonies today have been pretty impressive about what you're doing for the children of those 13 counties, am I right? 19 counties, so thank you. But you could maybe give Assemblywoman Peoples the information so that we can bring that back. I think it's very important, and thank you for waiting so long.
Thank you. We also have a bin with 6,000 postcards that we'd like to present to the panel. 6,000 signatures from people who have said that they would like for CPC to stay in West Seneca doing what it's doing. We also have for each of you vignettes with Catalina, Vern, and some other young people's stories about how CPC has assisted them. We know they will bring tears to your eyes. We hope that you will listen to them attentively as you make the next best decision.
Thank you, Stephanie. I wanted to ask one question as well. What's the average age of the population, the 47 that are there now?
Well, we have 3 units. We have a children's unit that can accept children from 4 to about 10. There's an adolescent unit, which is basically around 11 to 17. And then we have a double lock unit called an intensive treatment unit that serves children with higher behavioral needs, and those ages could vary.
So I'm sorry, say that one more time.
An intensive treatment unit where the ages of the children vary on that unit because of the severity of their mental illness.
Okay, I wanted to just ask Stephanie one more question. So the ages of, they're probably not older than 21 who are in this
18
facility.
would be the limit.
18, okay.
Yes.
And clearly in the Buffalo Psych Center, people are much older than that.
That is correct.
And generally, I mean, I don't know how long people stay at the Buffalo Psych Center, but if your average time is 90 days, and I'm just going to guess that their average time may be longer because maybe these folks didn't have the kind of support you provide young people when they were young,
Yes.
so they maybe stay longer. I just don't think it's a good vision to look out a window and see adults who are having the problem that you're trying to deal with right now. It doesn't seem to me that it will make you feel like you can get past this. You can get past this with the treatment that you're receiving there. If you look out and see older people, we're still, suffering from kind of the same illness. So I, more than ever, really think that this is a mistake. We should be trying to keep this facility where it is.
Thank you.
Okay, thank you.